Akwesasne and the rest of the Seaway Valley. Welcome to a live edition of CKON Wednesday to Atala. My name is Reen Cook, and the original air date of the program live is Thursday, December 3rd, 2020. And we'll remind you, views and opinions expressed by our guests and our callers during Atala, not necessarily those of 97.3 CKON or the Akwesasne Communication Society. And we would like to let you know the phone lines are open. If you have any questions, you can call 518-358-3427, 613-575-2101. So the only way that you can get your question on to the Grand Chief is by calling the radio station. And he'll explain that during the first part of his presentation, because we will be on Facebook Live with the Mohawk Council of Akwesasne Grand Chief Abram Benedict. He is here for his monthly update. And what we do with the program is we start off with the Grand Chief. He goes through his entire presentation, and then we open it up to the questions that our listeners and community members have phoned in, or any other questions that I might have with regards to the Mohawk Council of Akwesasne. So we always look forward to our programs, learning more about what's going on with MCA, how they're handling their response to the pandemic, and other very important announcements for the community, because we have seen changes and things could change from today. They could change tomorrow. So it is a fast moving world that we live in right now in dealing with the response to the COVID-19 pandemic. So with that, we would like to say Sego and welcome to our Grand Chief, Mohawk Council of Akwesasne, Abram Benedict. Sego, and welcome.
Segel, and good afternoon, Reen, and good afternoon, everyone who is joining in with us this afternoon. I hope all of you are continuing to do well at this time. As usual, Reen and the CKON staff are providing time for me to update the community today. I want to mention that we're streaming live on our MCA Facebook page, and we are recording the show to share later on. For our listening audience, questions will only be answered during the live show by phoning CKON at 575-2101 and 358-3427. For today's discussion, I will be providing an update on the COVID numbers, the MCA's reopening plan, the COVID care packages, and holiday preparations. It has now been over 8.5 months since we have declared a state of emergency for Akwesasne. It's extremely unbelievable that how much time has passed and everything that has happened. I do want to acknowledge that dealing with this pandemic and practicing all of the necessary precautions has and continues to be challenging for everyone. You are not alone in your frustrations. On behalf of the Mohawk Council of Akwesasne, I want to thank everyone who continues to practice all of the recommended precautions day in and day out in our fight against the spread of COVID-19. It's really important that as a community, we do not accept a sense of false security about this pandemic. It is not over, and everyone still continues to be at risk. We have to be smart about this. Please continue to wear a mask and maintain the 2 meters distance from others in public. As you know, COVID-19 has made its way here in Akwesasne. There continues to be confirmed cases on both sides of the border. The second wave is here, but whether this second wave is big or small is ultimately up to us. We can ensure that it is a small wave by continuing to practice all of the safety precautions at all times, and everyone who is most vulnerable needs to be extra careful. The numbers of positive cases in Akwesasne and the surrounding areas is very concerning. However, the increase in numbers is not overly surprising, as the cold weather is now upon us, and the virus tends to spread a bit faster in colder temperatures. We all need to be mindful that the time frame between the Canadian Thanksgiving and New Year's is a dangerous period. Normally, this is a time of year for increased socialization due to shopping, our students coming home, travel, holidays, and family gatherings. This year, we need to be especially careful throughout this dangerous period to prevent the spread of the COVID-19 virus. We would like to see our numbers drop back down and stay down. This will depend on how we all act. It is up to us individually, and it is up to us as a community as a whole. We saw an increase in numbers following Canadian Thanksgiving. We saw another increase following Halloween. Right now, we have another week to see the results following American Thanksgiving. And remember that the overall results of this dangerous period will not be fully realized until mid-January, approximately 2 weeks after New Year's. It is so important that each of us and every community member take the necessary precautions throughout this time frame. We do not want to see a widespread of COVID-19 cases in Akwesasne. On November 17th, the MCA Department of Health released their recommendations that gatherings be strictly limited to those who reside in your household. This is the safest way to prevent the further spread of the COVID-19 virus. It is important that everyone realizes that family gatherings and even small social gatherings are currently the #1 factor in the spread of the virus. We need to limit every chance of this virus has to spread. We ask for your cooperation, and it's extremely important that we follow all the health measures. On November 23rd, the MCA reinstated the community curfew in accordance with the Akwesasne emergency curfew law. The curfew is in effect from 11 p.m. to 5 a.m. We are hopeful that this precautionary measure will help keep the community safe, and we ask that all community members to comply with this added restriction. I do want to provide a rundown of the current cases in our area, and this is as of yesterday. The Franklin County has 48 active cases and has a total of 263. St. Lawrence County has 222 active cases, a total cases of 953. The Eastern Ontario Health Unit is reporting 117 with 868 total cases. The MCA currently has 2 active cases and our total cases have been 32. The SRMT is 15 with a total cases of 70. For MCA's numbers, we also want to further break down the number of the confirmed cases over the last couple months. When the pandemic started from March to June, we had 0 cases. July, we had 1 confirmed case and 1 recovered. That case recovered. August, we had none. September, we had 1 confirmed case and that case recovered. October, we had 7 cases. In November, we've had 23 cases, a total of 32 cases in our community. All the confirmed cases are considered to be active until they have been deemed resolved by a healthcare provider. The breakdown shows that MCA is currently reporting 2 active cases. Of the 32 confirmed cases, 30 of them have just occurred in the past 6 weeks. This is extremely important that people realize that in the last 6 weeks, we have seen a significant increase in the cases. Again, as a constant reminder, to reduce your chances of being infected by this or spreading the COVID-19 virus, we must regularly and thoroughly clean our hands and wash them with soap and water. Avoid touching our eyes and nose and mouth. Make sure you and the people around you follow good hygiene, respiratory hygiene. Wear a mask or other face coverings in all indoor public places. Maintain at least 2 meters or 6 feet distance between yourself and others. Avoid or limit any activities that put you in contact with anyone outside of your household. Stay home and self-isolate even with minor symptoms such as a cough, headache, mild fever until you recover. Have someone bring you supplies. If you have questions or symptoms, please call the MCA Community Health Program for pre-screening by phone. They will schedule a COVID-19 test if necessary. If you are awaiting COVID-19 test results, it's extremely important that you continue to quarantine for as long as your healthcare provider advises. We have been advised that people are waiting on test results and are not quarantined. This is extremely risky behavior to do and puts everybody at risk. Do your best to keep updated on the latest information, but only from trusted sources. Not all sources are trusted and credible information. If you have any questions about COVID-19 or the testing, please call the Community Health Nurse Program at 575-2341. Here are some additional statistics that I want to share as well that has been provided by our community health nurses. From March 13th to May 31st, we had 671 calls and 40 tests were administered. From June 1st to June 30th, 288 calls and 64 tests were administered. For the month of July, 872 calls to the nurses, 339 tests were administered. The month of August, 359 calls, 92 tests. For the month of September, 409 calls with 128 tests administered. And for the month of October, 351 calls with 103 tests. For the month of November, 1,104 calls to the community health nurses and 300 tests were administered. With a total of 4,000 calls and over 1,000 tests have been administered for the COVID-19. Our collective efforts to protect our community, and especially our most vulnerable community members, have overall been successful. And that's something each and every one of us should be proud of. But we must continue to work hard and keep ourselves and our community safe. With the rise in the COVID-19 cases immediately following Halloween, the MCA closed all non-essential services to the community until further notice on November 1st. Services and buildings were reopened to the community just this past Monday on November 30th. In addition, a tentative schedule for the holiday season has been set. From December 25th to January 3rd, the MCA offices will be closed. January 4th, the MCA offices will reopen to staff only, and on January 11th, MCA offices will reopen to the entire community. I want to ensure that the community is aware of these dates, but also know that they are tentative and they are subject to change depending on the number of cases within our community. The Mohawk Council of Akwesasne is preparing COVID care packages for distribution to the community. These packages will contain signs for a community household, a grocery shopping list, a contact tracing sheet, a screening tool sheet, information about isolating and quarantining and the comparison of COVID-19 versus the flu, useful MCA department information, emergency contact magnets, 21 days of positivity, which includes self-care activities for your family and yourself to stay healthy and happy during the holiday season, a disposable mask, disinfectant wipes, hand sanitizers, and a digital thermometer. The COVID care packages will be hand-delivered to each community household within the territory by district chiefs aboard an ambi school bus in the coming weeks. All safety guidelines will be followed and PPE will be used. This initiative has been in the works for approximately 2 months with the ongoing health and safety of the community as a driving factor. These packages are limited to 1 per household, and the Chiefs Committee will be working and keeping track of the households and addresses. If you are not home, these packages will not be delivered. Their contact information will be left for you. Please keep an eye out for these packages in the coming weeks. The last topic I want to discuss, Reen, this afternoon is preparation for the holidays. I realize I've touched on a lot of this throughout today's discussion, but we just want to ensure that everyone is safe throughout the holiday season. We are in the middle of a dangerous period that I've already described, and it's very important that all precautions be complied with. As difficult as it may feel, we need everyone to limit their social interactions only to those in your household. This is the safest way to prevent further spread of COVID-19. Using a variety of platforms available with today's technology, you can connect virtually with family members and friends, those within Akwesasne and essentially those located anywhere in the world. The bottom line is that we want everyone to make conscious decisions about their actions during the holidays and keeping yourself and our community at the top of mind and a top priority in keeping us all safe. Reen, that is everything I wanted to cover today in my update. I'm open to take questions from you and the community at this time.
All right. Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict and just doing his presentation there. So like we've done in the past, this is the opportunity for you, the community member, if you have any questions about MCA, if you have any questions about what he discussed today and what he presented to the community, we'd love to hear from you so that we can get that information for you. You can call us here at the radio station, 518-358-3427. 613-575-2101. I do have a couple of operators dedicated to the phones today, so they will take your question down for you. So please don't be afraid to reach out if you have any questions. So we're going to start off with one of our questions from one of our listeners, community members. They say that MCA rescinded the housing bylaw, and this person is wondering why there wasn't any community involvement on that decision. So again, this has to do with the housing bylaw. They said that MCA rescinded it, and they want to know why there wasn't any community involvement on that decision.
Thank you, Reen, and thank you to the community member for the question. So recently, the Mohawk Council did rescind a community regulation that had been listed as a bylaw in error. There had been a request from one of the district chiefs, a couple of district chiefs, to have an examination of a listing of a community regulation that was enlisted as a bylaw that so what we done is we had asked for a review to be done, a very extensive review. This community law dated back to the late 60s and the 70s and had gone through some transformation in the in-between. It was determined that it was not, in fact, a law. It was a regulation that was accepted by council. And currently right now, regulations are accepted by council without having to go through any process of law enactment processes. So the council determined that the best action would be to rescind the regulation, and that was done in the last couple of weeks. If the community is interested, we can do a more comprehensive presentation on this at one of the upcoming general meetings. Again, I know that not everybody has access to or is comfortable with the Zoom system, but all of our general meetings are recorded and are streamed live. Sorry, not live, streamed back on our Facebook and other means. We can, do that and have a more in-depth conversation about this. But essentially, that is what has happened with respect to that.
Okay. Earlier this week, actually yesterday, we had heard that Salmon River Central School District, and that included the Siverages Mohawk School, they're going to go back to their in-person learning setup, and they're going to do that on Tuesday, December 8th. When they had originally planned for this, they had announced that they wouldn't be back in school, in-person learning until like the first week of January. So the Akwesasne Mohawk Board of Education, we know, is full remote right now. We're wondering if that will have an impact on any decision making by AMBI. Is there any chance that the kids would be returning to in-person learning as well? I know that Dr. Harper, superintendent, had referenced some data and statistics and what they looked at when they decided, okay, we're going to bring the kids back now. Because he had mentioned and referenced the fact that they're safer in school. It's one of the safest places to be, according to the data that he's utilizing to help with his decision. So, Grand Chief, will there be something that AMBI looks back over, or are we going to stick with the plan right now?
I believe thus far, AMBI has set a January tentative. Of course, it has been several weeks now that the students have been at home and doing remote learning. There's lots of back and forth in other systems around us that, can support or dispel, whether or not in-class learning is the best option for the children to be in. And, we were one of the first in the region to go remote. I can assure you that the Board of Education through AMBI continues to dialogue regularly with the staff and the parents to ensure that, the needs are being met. This is not, obviously a perfect situation. It is unprecedented what we are dealing with. I do know that they'll continue to monitor what is the best approach for this. At this point, it is January. There's a lot of factors that must be considered, as well as I mentioned earlier in my presentation. We are, I think, at a critical point right now with the stacking of American Thanksgiving, Canadian Thanksgiving, Christmas, and New Year's, and the decision to be remote has been driven by cases and risks in the community. So I think that likely a decision will not be made or reannounced anytime until at least January, until we have seen what the total impacts will be of these holidays and the positive cases. So stay tuned. There's lots of factors on that, but if there are concerns and opinions, I do know that the Board of Education and their trustees are always looking for feedback from the community, and I welcome that. So it is a complicated decision, but it is continuing to be monitored, and I don't expect something till January.
Okay, so another question as a follow-up to the housing question. Who did the review on the housing regulation that they rescinded?
One of our legal counsel did a review of the rescinded regulation, and I can tell you super comprehensive because of the legal counsel actually has done a number of reviews and handles one of our oldest cases, which is the Seaway case, which means that lots of historical records were reviewed, including meeting minutes of meetings that have occurred in the past, and the recommendation, came forth that it was a regulation and that council could rescind it. So it was not just, a couple resolutions were reviewed. There was an extensive process that was undertaken to ensure that, to understand the historical approach on this regulation.
All right, again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. He's providing his monthly update. If you have any questions for the Grand Chief with regards to the Mohawk Council of Akwesasne organization, their response to COVID-19, or any other topics that you'd like to discuss, by all means, give us a call, 518-358-3427, 613-575-2101. As we continue on, you referenced COVID care packages. Grand Chief, they announced this week as well, there were going to be some elder packages that were going to be distributed. I know one of the lead players there is Jessica Shenandoah. Are the COVID care packages that you referenced during the presentation today separate from the ones that involve MCA along with Jessica Shenandoah and other community grassroots contributions? Are those two separate things?
Yes, they are. The COVID care packages is an initiative that the MCA will be doing to every household. There is a elders care package that is being developed by a community group being led by Mrs. Shenandoah. We did, though, make a contribution to that project as well, but they are two separate projects.
Okay, just checking on that. So looking at the Canadian federal government, what are your thoughts on the information this week with regards to the Canadian federal government saying they're not going to be able to follow through on their promise for clean drinking water for First Nations communities across Canada? What are your thoughts on that, or any comment on that?
Well, it's very unfortunate. We must understand too, though, that we are very fortunate in our community that nearly 95% of our homes have access to and do have, in fact, potable drinking water coming from our water treatment facility plant. So, and that's been a number of years since we've had that. So we're extremely lucky to be able to say that, as many First Nations don't have. They may have, some may have water treatment plants in their community, but not every home is connected. So it's a matter of being connected as well. Here, most of our homes are connected and do have access to it. It's it is a complicated situation. We must understand that a lot of these communities are very small in the north, and require special technology, as well as they're faced by challenges of access to contractors, access to special equipment to be able to put this in, and having potentially a large land base of community with a small number of people. It makes it extremely challenging to be able to get water to everybody. It's I think that COVID has played a part in this, because the last year, over the last 8.5 months, lots of capital projects that would have been happening have not been able to happen. Or have only started late, which causes a lot of significant problems for access to contractors. Delays cost money. There's those sort of factors weigh into other communities being able to get clean drinking water. We'll continue to support any community that we can, however we can politically, to continue to pressure and advocate the government to eliminate all the boil water advisories and get access to clean drinking water. It's very unfortunate, but I'm confident that over the next couple of years, the government will continue to push this as a priority, and that we will continue to advocate for other communities as well where we can.
All right, let me ask something else with regards to the Eastern Ontario Health Unit. Who meets with Dr. Paul, like on our behalf? Do we have a representative at the table whenever he gives his updates, or how do we communicate with him? What's it like for exchange of information and things. Do we have someone that is right on that and works with him every day or twice a week? How does that work?
Yeah, so Dr. Paul directly, I participate twice a week in 2 sessions with him on briefing sessions. So he does have one that he does with media. I listen in on that as well. And another day of the week, he has one with regional elected officials. So I participate in that as well, where he will provide, recent updates, will provide, insight into what the government's response or next steps are. We'll answer questions as well. So I participate in those. I do know that our health department, the director of health, does participate in regular other sessions with Dr. Paul as well, and other regional health representatives in very similar conversations happening there as well. And then on the ground, our health nurses are in regular contact with the Eastern Ontario Health Unit staff as well, discussing the positive cases, discussing contact tracing, and any other conversations that need to be had to ensure that the positives or the testing is and everything that supports those actions are happening. So there is lots of conversations that happen regularly with Eastern Ontario Health Unit at all levels.
Are there plans for when, God forbid, we end up having a number of Akwesasne that have to be hospitalized because of the COVID-19? What are the plans for that? Like, do we have a plan as Mohawk Council of Akwesasne, where we're going to be able to send our community members if they need to be hospitalized, if they got to go to the ICU or things like that? What are the plans for us? If we get above a certain threshold, when we need to look at, where are we going to send everybody if we end up with a number of positive cases where people actually do need to be hospitalized because of it?
Yeah, so the in a number of those conversations or updates that we have with Dr. Paul, they generally provides the current status of the capacity of the Cornwall Hospital, including the other, Glengarry Memorial Hospital, and I believe another hospital in the region, so that people can understand, kind of where the region is at in capacity to respond to the need. So we continue to receive those updates. We recently had members of my council and myself a conversation with the Red Cross as well. You may have heard on some of the national media that, other provinces may ask Red Cross for assistance. We did have a conversation with them. They have outlined some of the supports that they can provide as well. And that does include, having to set up whether it be quarantining units or units to be able to hospitalize. I say that, in that situation would be tenting hospitals. So we've had a conversation with them as well, and they have said that they're able to assist if we come to that point. Now let's really be clear. Let's hope we don't get to that point, and that is based on our actions. And I know that, there has been things online that says, well, 90 some odd people recover from this disease. It's not killing, amounts of people. In our community, one death is one too many, and one death of anybody for any reason is one too many. But it's also important to understand, though, is that while many may contract this virus and recover, some do need additional medical supports while they're recovering, while the virus is active in their body, and that may include oxygen as well. So there is only so much, oxygen machines. There's only so much oxygen that is available, at any time. It can be made. More machines can be made. Absolutely. ICU units are the same thing. That's why it's extremely important. While somebody may need oxygen, somebody may go into the ICU unit while having the virus, but if there's too many, it overwhelms the system. So then it becomes to the point of who gets it and who does not. And we do not want to be in a position of, we only have X amount of oxygen machines available in this region. Who's going to get them? Who really needs it? That's what people need to understand, is that it's those sort of impacts that a large surge in numbers will have on the healthcare system. and it can be devastating, and that's why it's extremely important that we continue to do all of the, the recommended precautions and keep ourselves safe. We don't want to see a surge. We don't want to have to put up temporary hospitals, temporary isolation units, things like that. That is the biggest threat to us, and that is what a lot of the states and the provinces are seeing now. And those sort of impacts are in our hands, and it's based on our actions. So I can't stress that enough. While we may, many people do not die from it, it's everything else that it causes to the strains on the body and the systems.
Again, we're talking with MCA Grand Chief Abram Benedict from the Mohawk Council of Akwesasne. This is the monthly update. And if anybody has any questions for the Grand Chief, he is able to answer those. So give us a call here at the station, 518-358-3427, 613-575-2101. So Grand Chief Benedict, we do have another question with regards to the COVID relief. They would like to know, will there be any checks issued for COVID relief to community members?
We continue to look at ways that we can provide initiatives to help support, homes financially through the COVID pandemic. We announced at our last update that we have increased the fuel allotted amount to the community. That is in an effort to help support community households through this time. We will continue to look at other initiatives that we can support the community by. The MCA offers a wide variety of services. I can tell you that, food security, access to food is an initiative that we are working extremely hard on in the MCA here to make sure that any families that do have shortages of cash to be able to feed their families, that there are initiatives to be able to support them. The Akwesasne Board of Education as well has been sending lunches to a number of families. In fact, I believe, I think they're up well over 100 families right now to support children at home to ensure that they're not hungry. Will we be sending direct payments to each household? Not exactly at this point. Within, there may be an initiative that we're rolling out in the coming weeks that will help support, that will be in lieu of the Christmas dinners that we normally have, because every year we have a Christmas dinner. We welcome the community to come in. We serve, well over 400 meals during the 3 events that we have. That's a lot of families. So we're going to be rolling out an initiative on that in the next couple of weeks to support families in lieu of not being able to have dinner with us. But we're continuing to examine this. If the cases surge and we see a lockdown again and people can't get to grocery stores, people can't have access to some of the essentials, we will react immediately. But at this point, it's not going to be, there's no, direct home benefits in a form of cash as part of the pandemic relief.
All right. So another question we've heard over the last couple of weeks, the vaccine. So we've got, a couple of companies that are vying for approval, I'm sure, from the Food and Drug Administration over in the US and likely Health Canada in Canada. So when do you think we will have the COVID vaccine for our community on the northern portion?
Mm-hmm. This is a conversation that has been happening for a number of weeks now, extremely important to us and, the globe in which we live in. At this point, we do know that Health Canada or the Government of Canada has secured a number of contracts with providers for a vaccine. They have not set a definite date of rollout, but it will also be, they would be rolled out potentially through the provinces as well. So every province right now is gearing up to look at what to plan out what a rollout of vaccine will be in the provinces as well. So we'll be continuing to monitor and receive information about that. There is no definite date been set yet, but we do know that priorities will be given for the vaccines, and that is the long-term care homes. We've seen a number of long-term care facilities in every province have devastating outbreaks. We have not, and I do want to give a shout out to our families and our staff and all of our healthcare staff that are keeping our dotas safe. But they are a priority and will receive the vaccine. That the staff, healthcare staff, as well as have been identified as a priority listing. The elders and vulnerable people. But again, this will be, and it will be optional. It is not going to be mandatory. But I think that, we'll have to, as we receive more information, we will continue to roll that out to you and to the community in various forms to keep them updated of where that's at. No date has been set yet. Our people are a priority listing. We are gearing up to make sure that our nurses can help and will be able to administer this as well, because imagine, so many people lining up for a vaccine in a situation where you're supposed to be social distancing. We have to continue to operate all of our other services, but also now deliver a vaccine. There's a lot of preparations happening in the health department to make sure that we're prepared to do that. Likely early 2021. They think that from all indications that by February, March, it will be fully in the rollout mode, if not sooner, to the high priority areas. So that's the only information I could share at this time. It is it's a very hot conversation right now, and lots of information we're just receiving daily right now on that. But we'll continue to make sure the community is updated.
One other item, just wondering if this has been a part of the conversation, is the actual storage of the vaccine. Like for us here in Akwesasne, do we store our own flu vaccine, or do we go over to Cornwall to grab it? I know it's not the same temperature and holding cycle for the flu vaccine versus the COVID-19, but I know they've been talking about the fact that it has to be a certain temperature, it has to be used in a certain amount of time. Are we looking at purchasing any of those special freezers or holding containers to keep that vaccine fresh and able to utilize? Are we looking at that at all?
My understanding is that one of the vaccines, and there's a few that are close to being approved, one of the vaccines requires that they be kept at a very, very cold temperature, and a temperature that is not achievable by our normal freezer in our home. I mean, in fact, it would be a specialized freezer. I would say that this likely is not going to be something, will not be the vaccine that we will have in this region, unless that is all that has been approved, and then we will work with the Eastern Ontario Health Unit to be able to roll that out. They will be where we will be getting the vaccines from. They actually supply us with vaccines now in immunizations for our other immunizations that we give to our our young ones, or regular shots that are needed or required to keep healthy. They're our partner on that now. They will continue to be our partner on this vaccine initiative for the COVID-19 virus.
Now, looking at another question with regards to something totally different, any updates on the Indian Day School claims? Who would this person contact in MCA for that information or for assistance?
Mm-hmm. The Aboriginal Rights and Research Office has been assisting community members with the administration end of the claims. There is a 1-800 number to the law firm that is leading this. We can provide some technical information, but the more comprehensive claims, or if they have legal questions, is referred back to Gowlings. They are the firm that's leading this. But the Aboriginal Rights and Research Office is the immediate contact. If you need forms, have some technical questions on it, they can assist. I do welcome community members as well to reach out to any of their district chiefs as well. If they have any questions, they can assist. If not, they can help facilitate the answers for that. We potentially will be hosting in partnership with a third party another information session or intake session. That details has yet to be determined. It's important to remember, though, that while folks maybe want to get their application in so that it's processed sooner, the deadline is not until I believe 2021, if not late 2022, if not late 2021. So there's lots of time as well. What I can share is that it's taking several months for the claims to be adjudicated and if awarded to be processed, looking at 6 months for the lower level claim and up to a year for the higher level claim. So people, just so they're aware, it's not a fast process when you get the application in, and to be patient at that time. So Aboriginal Rights Research Office, one of your district chiefs, if you have additional questions, and we'll help facilitate them from there.
Is there anyone that's working on or has acquired, when you're trying to prove that you went to a school, some of the class photos and things? Do we have, I know that we have an archive for the Mohawk Council of Akwesasne. Is that something that someone has thought about doing, or are we currently doing, that community members would be able to utilize and get copies of through the Mohawk Council for these different Indian day schools that operated up until the early 90s, right?
So we have minimal records at our archival center of pictures or student records. It's important too to know that up until 1987, the federal government ran our schools here, which means that they had the records. Some of them may have been turned over, but how it works is that the actual school record follows the student. So it goes with them as they excel in school. And then we don't have a high school here, so those records would have left our school system when they went off to high school, and then they become part of the whether it be in Ontario or Quebec. I'm not exactly sure how it works in New York, but they would have then gone when they graduated high school into the Ontario archival systems. So some of the information is scarce that we have here for a number of reasons. But again, they can reach out to the Aboriginal Rights Research Office to discuss some of that as well, their district chiefs. The other thing that they're being able to rely on is other person's testimony, that whether they either attended that school or that they had witnessed some of the horrible actions towards that student. That is a possibility as well, to speak to some of the classmates that you had went to school with.
If you have a number of COVID positive people that don't need to be hospitalized but still need care at home, the listener would like to know, community member wants to know, are there staff that can go into the homes to help take care of them?
There wouldn't, if they need to be taken care of physically, there may be a conversation with a healthcare provider that they perhaps go into the hospital. If they need, access to groceries, essentials for the period of them being contagious, or the 14 days that it takes to resolve, the nurses do contact them regularly. We are actually in the process right now of creating a repository for individuals who want to help people that need to bring groceries to their home. So we're developing that right now. We haven't got all the logistics set up yet, so that if you don't have a family member that can get certain items for you for the time period, we're developing a repository of volunteers who will assist with that. I would say though, if you're in dire straits, the nurses are calling those persons who are positive regularly. I have a conversation with them. They can help navigate through some of the other MCA programs, but also we do, we need to rely on our families as well to support as much as possible. That we do realize that not everybody has family members that can run to the grocery store for them, or the pharmacy, what have you. But every situation is unique, and there are the services available through the MCA. If not, we will find a way to assist when they're in need.
Another community member would like to know, with regards to Akwesasne and Untitled. There have been people in the community that have stepped up and made donations, or have collected money, or have done raffles and things like that for the benefit of Akwesasne and Untitled to be able to have their Christmas fund. Why doesn't Mohawk Council of Akwesasne take on this responsibility as a whole? Like, why are they left kind of standing there with nothing to give the residents and things like that? Is there funding for that, and is that something that can be looked at? If not,
Mhm. Well, I don't think that they're left with nothing. There is an activities funds. I think that we're probably at this point speaking specifically to holiday funds, holiday initiatives that the homes are doing for the residents, meaning they're buying them gifts or putting on shows within the staff for the duras. We haven't been approached directly. I do know that members of council have supported these initiatives individually to the homes, but I can assure you that if there are shortcomings that are needed, the administration of the MCA will support as much as they can. But I've seen on social media that the regular fundraisings are occurring that would normally happen to support some of the holiday initiatives. If there are shortcomings, we can absolutely look at supporting that.
all right. What kinds of services and mental programs are you offering during this pandemic time?
Mm-hmm. Well, it's there's no doubt that we're extremely concerned about the mental health of all of our community members. There's no doubt that at this time during the pandemic that we all are feeling the pressures in many ways of having to deal with the pandemic. Many of the services of the Mohawk Council are still available. They are just not happening in person. Some are and some aren't. The counseling services are still available. We ask people to please give a call to the health department. They will help navigate you through getting an appointment, likely be virtual with a provider, or I don't think it's in person at this time, but the services that have been available are available right now. It's extremely important that people reach out. There are also 800 numbers. We do have a local 800 number that we have for mental health, but I can assure you that these services are still available, and those who are in need, I encourage them to reach out and schedule an appointment.
When are the district chiefs and other employees for MCA going back to work in their offices?
Mhm. So the employees are in some places where they can't social distance are on rotating schedules, either working from home or working at remote locations within the organization because social distance is extremely important, even in the workplace. The district chiefs as well are working remotely. They do have touchdown offices here in St. Regis at Administration 1, but they're all available by cell phone, by calling the MCA administration, or by email. The system here allows that when you do call into the MCA and ask for a district chief, they can immediately transfer you to their cell phone, and you won't even it saves you from having to look up their phone number. So that system has been set up. In fact, that system has been set up for a number of employees in the MCA to be able to work remotely, to be able to receive calls as if they were at their workstations. But for the most part, since we are open back to the public now, staff are here and providing the services, and some staff are on rotating, working remotely and working in the office to ensure that they remain safe and are able to social distance while here at the workplace.
Is there anyone who has to return the CERB money, including seniors and retirees? Caller said some have received notices in the mail stating that the money has to be paid back.
This week, I just received a message from a community member in a similar situation. We are going to work with some of our partners to find an answer to this situation. I would say that every situation is different. We've had, you and I have had, some updates on this earlier on when the CERB was announced. It was designed for individuals that lost their income. If individuals did not lose their income, or if individuals were on whether it be a pension or Social Security, they may be in a position where they have to repay because they did not lose their income. If there was an individual who was working and lost their income, they would have been eligible for CERB. If they're receiving, repayment notices now, I would say the first stop would be through the Access here in Akwesasne, because they are a service provider for Service Canada, who is one of the the holder of the CERB program. Give them a call. If that is not still viable, we can have a conversation with our Member of Parliament, Eric Duncan, who has been helpful getting additional information for us. So it really is a case-by-case situation, but individuals who did not lose their income and are now required to pay back, maybe in a position where they're gonna have to find a repayment schedule. But again, reach out to those other Access First, have a conversation with them. And if all, there's no resolve or a clear answer, our office is available to assist as well.
Concerning the Dundee land claims money, when does MCA expect to begin the community consultation process concerning the Dundee land claims money?
Mm-hmm. So there was a committee of council that has working with our internal folks on selecting a manager for those funds to not to determine what's going to happen, but make sure that while it's in investment mode right now, that it's receiving its best investment as possible. So that process is just being finalized right now. We are currently still in the development phase. We have a framework of what a consultation will look like. We don't have a set date now. I mean, this because of the pandemic, we've all had to shift our priorities to other, the immediate, which is the pandemic. As well, it has created some challenges with not being able to meet in person. I think we have that down quite pat now, but it doesn't always suit individual needs. We recognize that. So I don't have a definite date at this time, but there is a framework being developed for consultation for the proceed usage.
All right, so I'm going to close the phone lines now. We'll close the phone lines and we will wrap up at the latest 1:20 p.m. So I do have a few more questions that have come in from listeners. So again, we will be wrapping up at 1:20 p.m. And I'm now closing the phone lines. I want to thank everybody that phoned in with questions. So I want to go back to, we asked about the district chiefs and working from home. So it says correction, I guess on the way I asked the question, why are district chiefs working from home when other employees are at the office? When will they return to the office with regards to district chiefs?
So there's a differentiation between the district chiefs and staff. The chiefs and myself are not staff of the MCA, so the comparison is not always comparable. They are. There is workstations here for them to use within the MCA. One of the challenges is that there's 13 members of council. That's 12 district chiefs and myself. We don't have individual offices for the district chiefs, which means, the social distancing now becomes, a reality. And we don't have, we can't get 12 district chiefs in one spot at a time. So that is why we do have the space here that is rotating for them to be able to use or meet community members. But I will say that, we are very cautious of when we meet in person, again, because of the social distancing, because of the virus. We want to make sure that everybody continues to be safe, but they are available via cell phone, via email, and by appointment if they want to come in. Calling ahead if you want to speak to somebody in person, to one of our offices or to them directly, can be done to speak about issues. But the district chiefs are not staff members. They do not punch in 9 to 5. They are elected officials that, when called upon, are there to assist the community, but are always, upholding their obligations, no matter where they are working working from. And the staff, comparison is a bit different. And we do have staff that are working remotely, accommodating social distancing where they can't work in the workplace.
Who pays your chiefs?
The Mohawk Council pays the chiefs. There is monies that's received from the federal government through some of the streaming that we get specifically for chief salary. It's not for all 12, it would be for the Grand Chief position. But the way the system works here within the MCA is that they are charged, the departments are provided a surcharge to support their portfolio allocation. So there is some comes from the federal government, some comes from internally, and some of it is unfunded.
All right. So in response to the question why MCA doesn't give or match donations to the old age homes, which we talked about, Junkarusane and Yakisota. So the caller feels some people have a big heart and do what feels right to them. So we wanted to pass that comment along.
Yeah, and I acknowledge that as well. I will say when this was raised, I think in our last session, I have not received anything official from the homes. Well, one may say, why do we have to put it official? But it's because if we are to make a donation, we have to put it through the issuance of a check process, which requires something in writing. And so if they are still short and feel that there is a need, we can entertain an official request from either one of the homes or, organizations that are providing support. They will go through the process for review and consideration at that point, but we do need something in writing.
What is the age requirement to receive the $900 on the northern portion of Akwesasne? And the second part of that question, how come everyone didn't receive it?
I'm not exactly sure on what $900 they're referencing. So if we are talking about the fuel allotment, I believe it's 60 and you'll receive the allotment as an elder. Anybody under 60 that's a head of household will receive, I believe it's $700. So, and that's paid to the fuel supplier, but there has not been any $900 payments made to the community members directly.
I think that they might be referencing something on the southern portion.
Okay.
If that's what they're looking at for that specific number. And if anyone has any questions on that, you could reach out, I'm sure, to the Siverages Mohawk Tribe. Compliance department would likely know about that if that's what they're referencing. But again, that question, second part, how come everyone didn't receive it? So there's that one. Now, Canadian federal government monies for Indigenous communities for COVID relief. Has any other money come into the Mohawk Council of Akwesasne by way of the Canadian federal government?
There have been some additional resources that have been provided in various areas to the Mohawk Council. There is, Indigenous Services Canada has provided some, Health Canada has provided some as well. I don't have the exact numbers at this time. Some of it is targeted for specific purposes. So the schools did receive some additional monies, which you can imagine, we've had to buy a mass amount of Chromebooks for staff and for students to be able to work at home. So that, there was a dollar value to that. They've had to, earlier on, make some physical improvements to the school to make sure that children are safe with putting shields at their workstations. The organization had to incur some costs as well. PPE as well is necessary, but comes at a cost. And I can tell you that it's a significant cost. Whereas before, you came into the workplace, not everybody had to be PPE'd up to serve the community. But, in some areas, like our health cares, our daycares, our nursing homes, they're full cap and gown and, mask and gloves. That stuff burns up fast because it's not reusable. So, there's a significant amount of costs being associated there. Well, there's some regular monies to support that. There's just not enough. We cannot be in a position where we don't have any money to pay for that stuff. Can't be in a position where we don't have access to that stuff. So it has been being stockpiled. So that's significant as well. The COVID care packages have a cost as well. We've done the food to everybody's home has a cost as well. The increase to the fuel allotment has a cost as well. So there's some incremental costs that have been there. What I can do, Reen, is in our next update, which will likely be in January, unless we get some surges that we really need to advise the community about, we can give a breakdown again on that. And we can also look at doing it at January's general meeting in the form of a presentation so that people can see that a little bit better. I know that people are always interested in knowing how much money we've got, and we're extremely open to let you know what money we have gotten and what it has spent on to support all of the community.
All right. So again, we're going to be wrapping up very shortly. We have already closed the phone lines. There's a power outage planned for Friday from Hydro-Quebec. Do we have any input into that, like when they do it, or why they do it, or when they do it, things like that? Do we have any say in that?
Not too much. We're pretty much advised that they're going to be having an outage for the upgrade of equipment. If there is something that is substantial to when they're planning to do it, we can, push heavily on them to reschedule it. But generally, they let us know that this date is coming, and this is when they'll be providing outages for upgrades. It is a frustration of ours as well. Don't get me wrong. That they're having outages, especially during the month of December.
All right. With regards to petitions, are there petitions that are currently in front of the Mohawk Council of Akwesasne being sent to Justice for signature verification? And if you could provide any information on petitions.
So we had received a petition, I believe, last month. This was provided in my regular weekly updates, and then which my weekly updates do form part of my monthly update. We had sent out a press release on receiving a petition and what it was calling for. Just this week, council passed another resolution in relation to that petition, and they nullified it because it didn't meet the specific requirement that Justice recommended. So that petition has been nullified and will not be actioned upon. We will be sending a release out to the community likely this afternoon, if not tomorrow, in relation to that. Now, I just want to put this out there. People have asked about petitions in the past, whether they can see who signed it. These sort of things have to go through a process of access to information, and then every individual on that petition has to agree that they can, that whoever's asking can see their name on that list. So if people want to know who signed petitions, we can't release that information. We can tell you we provide what the petition's asking for. We provide how many people signed it, how many eligible signers, but releasing names of who signed it will not happen here because people did not sign petitions so that somebody else can examine who signed them.
All right. So as we look to wrap up today's program, Grand Chief, did you have anything else to add before we do our formal wrap up like we normally do?
Well, there's one initiative that we had announced through maybe our last update. I gave a bit of an update on it, and that's a fiber to the home project. We were actually approved in 2018 for a fiber to the home project for the entire community, and unfortunately, we've been going through the bureaucratic process with the government and the approval process and the technical aspect. We've been having to work with our consultants to design what a fiber to the home would look like, and all of the technical parts related to that, the costs. That has just about been finalized. But what I can say is that the Mohawk Council knows that this is an extreme priority for the community, and having, working from home or having access to reliable internet service. A couple weeks ago, maybe last week, council authorized part of that project to proceed right away. And that announcement, I do believe, will be made this afternoon. But what it is that we are going to be starting with the SNI district first, with rolling out the fiber to the home project. Now, this will take several months, but boots will be on the ground very shortly in the coming weeks, and starting that project. So likely not until 2021, probably March, you'll start maybe seeing homes be connected, but we have authorized that part of that project move forward sooner than later. And SNI was identified because of the outage areas that the highest priority in the community. There's areas that you can't get it. There's areas where it's terrible. I do know that it's terrible in many places of the community. Don't get me wrong, including at my own home. But we know that SNI is the biggest area, especially with learning from home. It's hard to be able to ensure that our children are on, the virtual classroom when the internet's not working, or they have no internet or very bad internet. So that is rolling out in the very near future. We expect, as we roll into 2021, that the project will start beginning in the other two parts of the community as well, as SNI and St. Regis. So, but we've expedited SNI, and it'll begin in the next couple of weeks. So I want to share that with the community this afternoon.
That's very good news. Do homeowners or property owners, do they have to give you permission to go on their property to do this? Is that a process that people are going to have to deal with before they actually see the fiber and, being installed?
Yeah, there is the whole easement aspect. For the most part, the main lines, which is down the roads, will be ran within the road easement. So there are the water line and the road is on an easement. They'll run it into that. But in different areas where it goes down, private home or private lanes to your home, there will be potentially some need for consent from the homeowners. But that information will be rolled out in the next couple of months.
Okay, perfect. That's all that I have on my side, Grand Chief. If you would like to bring it to a close, please.
Sure, absolutely. Well, as always, Reen, thank you very much for making time for us. I don't think that we'll be having another session until January, unless, again, the numbers continue to warrant that I need to take to the airways to update the community. Hopefully that doesn't happen. Again, those, that's all in our, in our hands to a certain degree. The last 8.5 months has been extremely trying for all of us, and it's not over. And I can't repeat enough that we must all continue to do our part, the wearing of the mask, the social distancing when in public, and avoiding social gatherings. I know that's extremely difficult. We're running into the Christmas holidays, and people want to gather and people want to enjoy a nice meal with their family and friends, but we need to really think about those actions as we move into the holiday season. We have to continue to take this one day at a time and support each other all along the way. We have been doing a really good job here in Akwesasne, and there seems to be a light at the end of the tunnel with the vaccine rollout, but this is still months away, and we need to continue to just hang in there longer, support one another. So thank you, Reen, for spending time with me this afternoon. It's always great to update you and the community. Yamagoa, to all of our employees who are working hard to serve and keep our community safe, and to our listeners, as always, for the community members and our listeners for doing their part during these very extraordinary times. And I do want to say that on behalf of myself and the Mohawk Council, we hope that all of you have a great holiday season coming up. Be safe, and thank you for joining us this afternoon. Yamagoa.
Okay, Nyawagoa, that is Mohawk Council of Akwesasne Grand Chief Abram Benedict. Nyawagoa for being with us today.